All right. Good morning, everybody. Welcome back to this next session of the Fur Baby Summit. For this session, we have David Blackwell with us. And David Blackwell has a very interesting position. It's something that a lot of us have talked about. It's been a topic that's gained a little bit more visibility and a bit of notoriety in the last few years. It was a bit of a taboo topic for a while, but now it's something that seems to be gaining more steam in the mainstream. And that's about cannabis and veterinary medicine. So David Blackwell is with us, and David he has a degree in veterinary technology from Ross College. He's licensed as a registered veterinary technician. He's also a certified veterinary cannabis counselor. And if you've never heard of that, neither had we. So we were very excited to find say that 5 times real fast, the Veterinary Cannabis Society, and be able to sit down and take a look at what their mission is, what they're pulling together, what they're talking about, the different vets that are involved. There are some some amazing vets that are involved with this. And David has come on today to talk with us about this and what the society is doing, what they found out so far, and how cannabis CBD can help our fur babies. So David, thank you for being here with us. Oh, and I forgot to say, he and his wife also run the Freedom for the Stallion Spotted Equines. So, and David, you have 19 cats. Can I say that?
Yes, yeah, we have 19 cats at home, all rescues that we've adopted from the streets at one point or another.
We would love to have 19. I would love to have 19. If I had the land and the space, I would have 19 in a heartbeat. So thank you for that too. So thank you though for being here with us. I'll let you get started.
All right. Well, I'd like to start by saying thank you for having me. It's an honor to be here presenting on behalf of the Veterinary Cannabis Society and on behalf of the Vet Tech Ltd, which is my veterinary cannabis consulting company. I guess I'll start a little bit with the Veterinary Cannabis Society. It was founded by Doctors Trina Hazza and Gary Richter. And their mission is really just to further the research and the knowledge that we have about medicinal cannabis. We know that it's important, it's newly emerging as a discipline. So their goal is really to promote the industry, to promote the research, and remove the stigma that is behind veterinary cannabis and its use in our pets. I would like to read their mission statement, if that's all right.
Yes.
The founders know that what it's like to feel as if they're alone and believe no veterinarian should have to risk their license or put their livelihood in peril simply by trying to do what is right for their patient and honestly answer their clients' questions. And that's what they fight for in the industry and for pet parents. So we have that information, and so get rid of that stigma. I know one of the big topics, the big uses of cannabis for cannabis and pets is cancer. I know cancer can be a scary diagnosis. When you hear words like cancer or tumor coming from your beloved pet's veterinarian, it's common for one's mind to start racing with questions. Is there anything I can do? What are the treatment options? What's the prognosis? Is my pet going to suffer? How expensive is treatment going to be? Can I afford treatment? If I can't afford treatment, is euthanasia the only option? These questions are incredibly common. Asking them is perfectly normal when your pet is diagnosed with cancer. Your veterinarian will likely have given you options that would include surgery, chemotherapy, and radiation. All of those options carry with them some negative side effects. So the side effects of these conventional cancer treatments include loss of appetite, vomiting, diarrhea, lethargy, not feeling themselves, depression, and weakening of the immune system, which leaves our pets vulnerable to becoming ill much easier. All of those are likely to add to your pet's stress level and your own, and stress is another big topic that I wanted to touch on. The stress of administering the treatments themselves, which is just as stressful as what the pets have. Stress plays such a pivotal role in disease and the well-being of both us and our pets. Chronic stress itself also weakens the immune system. It raises blood sugar, It causes changes in the brain that result in depression and anxiety and lead to potentially negative behavior changes. Uh, Chronic stress and illnesses like cancer tend to come as a package deal. Um, so we want to know what can be done about all this stress in order to improve the lives of our pets. For your pet, the vet will have likely some options such as anti-anxiety medications. They'll have appetite stimulants, muscle relaxers. Those are all typically first-line drugs in this sort of situation. The question is, though, is there anything else that might help our pets? I know many people prefer treatments that many consider to be more natural or homeopathic. So is there anything like that, like I've described, that actually has scientific evidence behind it? The answer may surprise many of you, but it is a resounding yes. This is where many of the special molecules called cannabinoids that come from the cannabis plant come into play. To understand how cannabinoids may be beneficial, it's helpful to know a little bit about what's called the endocannabinoid system, which we all have. Our pets have it. We have it. Basically, anything with a spine has this system. Let's see. It was first discovered back in the 1980s. I'm sorry, go ahead.
I was saying you're good. This is good stuff.
Good. Awesome. It was first discovered back in the 1980s, but we've only recently come to understand how it works well enough to intentionally manipulate it for potential therapeutic uses. Believe it or not, the endocannabinoid system still isn't taught in depth, if at all, in medical and veterinary schools. That's why a lot of vets and even doctors just don't have this knowledge. And a lot of veterinarians are still skeptical and sometimes outright refuse to discuss cannabis-based therapies. And as a scientific community, we like to see hard evidence before we call something a treatment or a therapy. A little bit about the endocannabinoid system. It consists of what we call endocannabinoids. Those are made on demand naturally in our bodies. It also consists of cannabinoid receptors, which exist in many parts of our body, including the brain and nerves. They're in our immune cells and many other areas. And what we've learned about the ECS is that it acts in part as what we call a feedback loop for our nervous system. So that's when nerve A sends a signal to nerve B, the endocannabinoid system kicks in. It allows nerve B to tell nerve A, hey, I got your message. Without the endocannabinoid system, nerve A would have no idea whether nerve B got the message or not. So nerve A would just keep sending that message over and over again. So in that way, the ECS endocannabinoid system helps the body maintain balance. There's two main endocannabinoids, and those are the cannabinoids that our bodies produce on their own as part of that feedback loop. They're called AEA and 2-AG. I won't worry about the long technical names for them. Let's see. Seizures is one of the main areas where we use cannabinoids. And for those of you that have pets with seizures, you probably know that a seizure is a nerve impulse repeatedly and constantly sending messages without stopping. So it goes back to that nerve A and nerve B situation, where nerve B just isn't telling nerve A, hey, we got the message, you can stop. Those endocannabinoids are supposed to send that message for it. But that's seizures. We're here to talk about mainly stress. So how can the cannabinoids help with stress? Unfortunately, studies appear to demonstrate that cannabinoids do not directly affect the hormones related with stress. So your cortisol levels go up, blood sugar, things like that. So cannabinoids don't affect that. However, those same studies do note some change in behaviors when animals given cannabinoids are placed in stressful situations. So it changes their behavior when they're in those situations. Rather than decreasing stress, it changes how they respond to that stress. So what happens when we add cannabinoids like THC or CBD? Well, first you got to know what those are. Most people have heard of at least THC and CBD. They are the phytocannabinoids. That means they come from the plant, cannabis. We know the most about THC and CBD at this point. There are some studies in the works that are looking at CBC, CBG, and CBN. There are actually over 150 different cannabinoids, and several hundred more active molecules called terpenes and flavonoids. They're all derived from this cannabis plant, and some of them may or do have therapeutic potential. As I said before, we call these molecules phytocannabinoids because they come from the plant naturally, and they have similar or same shapes as the endocannabinoids I described earlier. And those shapes are important because the shape and chemical makeup of the molecule are what allow them to attach to the receptor in order to produce those effects. I did mention terpenes. Those are molecules that you're actually familiar with, even if you don't know it. They're the molecules that activate our sense of smell. So when we smell something like lavender, we're actually smelling a terpene in lavender called linalool, which is responsible for lavender's calming effect. Interestingly, linalool is also present in cannabis extracts and from some strains of cannabis itself. The point is we can make use of these special molecules to enhance the overall effect of a full spectrum cannabis extract in something called the entourage effect.
Mm-hmm.
The entourage effect is not completely understood at this point. We're still doing research, still doing studies, trying to figure out how it works in different animals and how different amounts of each individual molecule affect things. But we know that the entourage effect is the synergistic effect noted in patients who use a full or broad spectrum extract, and it's not present in patients using a true isolate. Now, what's the difference between a full and broad spectrum and an isolate? Well, full and broad spectrum products contain either all or most of the naturally occurring molecules from the plant it was extracted from, while an isolate contains only one specific molecule. So, for example, if you have a full spectrum product, it's going to have THC, CBD, CBN, CBG. It's going to have maybe some linalool, some beta caryophyllene. Those are a couple of terpenoids. That's going to be in your full and broad spectrum products, whereas your isolate's just going to be CBD, for example. If you have a CBD isolate, it's not going to have anything else at all, just CBD. Full spectrum products will have at least trace amounts of every cannabinoid and terpene that was present in that particular strain of cannabis that it was derived from. Broad spectrum products will have most of the cannabinoids, may be free of the delta-9 THC, for example, which is the intoxicating molecule that we all know. And one or two other molecules that were present in the plant, but that maybe didn't end up in the final product. That's a broad spectrum. There's products on the market right now that are purified CBD in a powder. Those would qualify as isolates, don't have anything else in them. The vast majority of these molecules are actually produced in the flower of the cannabis plant. Some are found on the leaves and stalk, but the vast majority are concentrated in the flower. I do want to mention that the reason I keep referring to the plant as cannabis rather than hemp or marijuana is because hemp and marijuana are the same plant. They're all cannabis. The difference between hemp and marijuana is largely a legal one, where hemp has to have less than 0.3% delta-9 THC based on dry weight when it's harvested. So any plant with more than that 0.3% THC is legally considered marijuana. And I know there's a lot of confusion in general around whether cannabinoid products can or cannot be prescribed. As of today, marijuana is still a Schedule 1 controlled substance at the federal level, which means that no one can prescribe it. In human medicine, a physician can recommend a patient for medical marijuana in states where it's only legal medically, but even they can't prescribe it to a patient. There is no medical marijuana pathway for veterinarians, unfortunately, so they can either prescribe it or recommend it. Now, this does vary state to state, and laws are constantly changing, which is why having someone like me, someone with a veterinary cannabis consultant background, who's familiar with your state-specific laws, is very important to having a guide to knowing what's legal and what's not, what you can and can't do for pets. I do want to touch on some products you'll see labeled as a hemp seed oil.
Yeah.
I get this question a lot. It is worth noting that hemp seed oil doesn't have any of those cannabinoids in them. So the cannabinoids are produced in the growing plant. An oil made from the seeds it's just an oil. It's not going to have any of those cannabinoids in amounts that would provide any benefit. That's all going to come from the stalk, the leaves, and the flowers. So getting back to our original topic, do cannabinoids actually reduce stress and anxiety? Paxton Lane Turner of Tarleton State University conducted a study on horses to determine if their behavior during feeding and their response to being transported differed depending on whether they were given a CBD product or not. Now, the study only used 6 horses, so we have to be careful about extrapolating those results and extrapolating to other species like dogs or cats. But Turner did find that the horses dosed with CBD showed less negative behavior during transport. And that suggests that CBD reduced the stress of transport. And again, it's not going to reduce the hormones that the horse's body produced, but it did change that stress behavior. In 2020, stress by Wallace et al. Found that dog owners who gave their pets cannabis products reported that products fulfilled their expectations of reducing pain, increasing relaxation, improving sleep, and improving overall well-being. Of course, those results are self-reported, which leaves some room for bias. Wallace et al. Also noted that we do need more objective data, which has less potential for bias. The Wallace et al. 2020 study, as mentioned previously, noted that pain reduction was reported by most of the dog owners surveyed. Additionally, somewhat more objective studies appear to echo the conclusion of Wallace et al. Vigil et al., for example, found that a full spectrum whole hemp extract reduced pain in mice during their experiment. A 2018 study by Gamble et al. Found that a specific dose of a broad spectrum hemp extract may help increase both comfort level and activity level in dogs with osteoarthritis, suggesting that the specific product they used may have been effective at reducing pain and or inflammation. Henshaw et al. Found that CBD, CBG, and CBD in combination with THC all produce an anti-inflammatory effect, suggesting that those specific cannabinoids may help alleviate pain associated with inflammation. Another big question often on pet owners' minds is, can CBD or cannabis cure cancer? Unfortunately, there's no solid evidence that I'm aware of at this point that leads me to believe that cannabis could cure cancer. The use of cannabis-based products in cancer cases typically have the goal of improving the patient's quality of life and alleviating some of the symptoms and side effects of more conventional cancer therapies, as I mentioned earlier. There is one anecdotal case report where a topically applied cannabis-based product may have caused or contributed to a complete reduction of one cat's oral squamous cell carcinoma, and that's the most common malignant oral tumor in cats. That study's really tough to find, and it's one individual, so we really have to be careful about saying that that's proof. But it does suggest to me that there's some reason to look further and research further into what a cannabis-based product may be able to do in situations such as that one. A 2005 study by Small Howard et al. Suggests that specific cannabinoids may be beneficial in mast cell tumor cases. A lot of you have boxers, dogs of breeds like that will be very familiar with mast cell tumors, as they're very common. But that study is far from suggesting that cannabinoids are a cure. Another important question I hear a lot is whether cannabinoids can replace their pet's regular medication. The short answer for that is no. Now, there are exceptions. The general rule is we're using cannabinoids as an adjunct or an additional mode of therapy. There are some anecdotal reports of pets with idiopathic epilepsy where they've been able to stop their conventional anticonvulsant medication and become well managed on cannabinoids, but those have not been confirmed by scientific study. Research is ongoing, and one of the goals of the Veterinary Cannabis Society is to compile all the available research in one place for veterinary professionals, for pet parents, and for industry professionals alike. Another question I see often is, isn't THC toxic? So in short, it is intoxicating. Like most toxic substances, the amount ingested determines whether we see toxic effects or not. At appropriate doses, it's unlikely to see any serious signs of toxicity. Most THC intoxication cases happen because a pet got into their human supply of medical marijuana or recreational marijuana in states where that's legal. This does illustrate the importance of learning how to keep your pet safe, which I'll go into more detail here soon. It's important to note that there is no lethal dose of THC that has ever been established. However, there are cases of dogs dying of THC overdose. Those are likely related to aspiration, sepsis, or contaminants in the product, such as maybe they got a hold of an edible that was chocolate based, they got that cocoa, and that was the real reason um, for the problem, rather than being the THC itself. A lot of pet parents worry that cannabinoid products will make their pet high. The high that is seen in humans is actually the intoxicating effects of THC. So, as I previously mentioned, it's not likely to see your pet in a high state as long as you're using appropriate doses. And that's another place where a veterinary cannabis counselor or a veterinarian that's knowledgeable in veterinary cannabis can help, is showing you how to dose the product appropriately. Additionally, other cannabinoids like CBD, CBG, and CBN are not intoxicating at all and will not affect your pet the way THC can. There are a few studies available that show that CBD dominant hemp extracts are relatively safe in dogs, cats, and horses. And this is very important for those of us in the professions. We want to know that it's safe. Um, I'm not aware of any of safety studies in any other species at this time. They may be ongoing. They may be forthcoming. In the past year, there's been over 3,000 different research articles in CBD. So the research is moving very quickly. I feel confident that more studies will be published showing safety in many different types of pets, and following a specific dose increase schedule developed by a knowledgeable veterinarian or veterinary cannabis counselor like myself can increase safety and reduce risks of intoxication. I get a lot of questions about how much should be given to a specific pet. The exact dose of a specific pet needs depends on many different factors and should be something you discuss with a knowledgeable veterinary professional. One factor is the molecular profile of the specific product being used. Another is the specific needs of the patient. We're finding that every pet responds differently, and therefore every treatment plan has to be tailored to the specific pet. There is some trial and error involved in finding the best product for the patient's needs as well. So if you do decide to try a cannabis-based product, be prepared to hear that the original product isn't causing the desired effect and that a different product may need to be tried altogether. Much like dosing, how easy a product is to give to your pet is multifactorial. Some of it depends on the product being used. For example, there are products that are less scented and make them easier to give to cats. Cats eat things based on their sense of smell. If it smells good to a cat, they're more likely to eat it. If it doesn't smell good, they're likely to shy away from it, much more so than dogs are. Dogs rely on smell, but are just as likely to rely on taste, which is why we get away with getting like oral flea and tick prevention into dogs, whereas in cats, it's much more difficult. Much of whether a product is easy to give also depends on an individual pet's preferences. Products like oils can be added directly to a pet's food. Some are formulated as biscuits or treats to be more palatable. So there's many different options. So now that you have all this information, how do you go about finding the right product for your pet? The best option is to find a veterinary cannabis counselor that can help guide you to products that are more likely to be safe and effective. VCCs have gone through additional education to understand the legal environment and the current research and are well equipped to help you find a product you can trust. Another option is to consult a holistic or homeopathic veterinarian. Holistic vets are often more open to discussing and more knowledgeable about less conventional treatment modalities. Another option is to go to the Veterinary Cannabis Society website. It's veterinarycannabiссociety.org. And check out find a practitioner to find a knowledgeable veterinary cannabis practitioner near you. If you're someone who prefers to do the research yourself, I highly recommend visiting the Veterinary Cannabis Society. We are building up our knowledge base as we speak and compiling research articles, podcasts, and much more. Veterinary Cannabis Society is also a 501c3 organization, and any charitable donations you make to them benefit our efforts to educate and advocate, and they also earn you a nice tax deduction. I do want to finish up. I mentioned earlier that I was going to talk about safety. So I do want to talk about harm reduction. If you're shopping for a cannabinoid product, I like to tell everybody to remember the ABCs. Those ABCs are: A is ask for a certificate of analysis. That certificate of analysis is going to tell you exactly what's in the product you're going to be giving your pet. There was a study done that analyzed several different products and found that many didn't match what the label claimed. Some of them didn't have any CBD at all. Some of them had much more than they were supposed to. Some of them had more THC than the label claims. So that certificate of analysis, it comes from a third-party lab, and it's really going to give you a little more peace of mind as far as knowing what you're giving your pet.
Mm-hmm.
So that's our A. B is beware of harmful ingredients. This is especially important if you're looking at a product intended for humans. There are far more products out there that are marketed to humans than there are marketed to pets. So the products marketed for humans, they might have things like artificial sweeteners like xylitol, which if you own a dog, you know that xylitol is very toxic for our pets, particularly to dogs. Other human products may be chocolate based and have cocoa in them. So you really want to check the label for those harmful ingredients. And that brings us to C, is finally check the label. Not only for toxic ingredients, also you want to know the total amount of cannabinoids and how much of each cannabinoid is in each drop or each milliliter or each treat, depending on the product you're using. So that's our ABCs. Remember, ask for a certificate of analysis, beware of harmful ingredients, and check the label. It's also very important that you know the signs of intoxication and seek treatment if you begin to notice your pet acting more lethargic, acting sensitive to light noise, walking as though they're drunk, catching themselves from falling over. We call that startle response. I'm sure you've seen it before. If you've ever experienced this, it's where they'll kind of fall asleep and then jerk themselves back. That's the startle response. That's really common to see in THC intoxication. Also, dripping urine, incontinence is a big one that we see. So if you see any of those signs, you want to stop giving the product immediately. Call your vet or the closest veterinary emergency clinic. Again, there is no lethal dose of THC that we know of. It's typically not life-threatening, but if severe, it should still be managed by a veterinarian for the quickest and most optimal recovery. The last thing I want to cover is if you do give your pets a CBD product or a cannabis-based product, be sure you're keeping a journal. Write down the dose you give, what time you gave it, and write down any changes you see. That can be behavior changes, appetite, drinking, or changes in stool. If your pet vomits after you give it, any slobbering, anything at all, whether it's a good or a bad effect, or you're not even sure if it's an effect. If it's happening after you start giving a CBD product or a cannabis-based product, write it down. That's all going to help us in the future to figure out what the potential negatives are, what the potential positives are. So you really, when you do that, when you keep that journal for us and you report those things to your veterinarian, that helps us know what's working and what's not. And that's really all I've got. So I'll open it up for questions, Stephanie, if you have any.
We do. And I think so for everyone listening, that is a lot of information.
Yes. And
I highly recommend you go back and listen to it again and to go to the website. It's veterinarycannabiссociety.org. This is something that is really important to us because it's, as David mentioned, like it falls into line to act as an extra tool in our toolkit to help our fur babies. And I had not even heard of it until a few years ago, and it was, as you said, it's one of the top things dealing with cancers. And no, nothing against them, but no vet wanted to talk about it, and I understood why. But I found a holistic vet that I could have a conversation with it about, and it opened up a whole other chapter, a whole other realm. There's so much information about it, but it was hard sort of to sift through the noise. So it's helpful to have somebody who understands what it is, how it breaks down, how it's made, how it affects them, what to give them, what not to give them. And like you said, one of our main questions are, is it safe? Can we do that? Um, I know we have one question. Now we see a lot of different brands, a lot of different CBD products that are in pharmacies. I know we have a wellness pharmacy here in Austin that carries a lot of natural healing items, supplements, vitamins, but they also carry CBD for humans and for pets. And some of the holistic vets out of Colorado, of course, were carrying that too. But if can you give them any some insight on how, if they're in the store, because you can get overwhelmed, kind of what to look for as they're looking at, these individual boxes and bottles for what might be something safe and something good to try with their dog or their cat, if that makes sense.
Sure, sure. So that comes back to those ABCs that I was talking about. Is
Mm-hmm.
just want to check the label, make sure there's no toxic ingredients, and if it's at a pharmacy, pharmacists should have no problem giving a certificate of analysis for the products that they carry. Being medical professionals, they understand, wanting to know what's in a product before you give it. So those are going to be the main two things. From there, it's just as long as there's nothing toxic in it. It doesn't have more than that 0.3% THC. Um, Go ahead and give it a try.
Mm-hmm.
Start with, depending on what the label dose is. I like to start at the lowest possible dose, work my way up. That way I can watch for toxic effects. Um, of course, if you start seeing toxic effects, you want to stop immediately or go back to the lower dose that didn't have those toxic effects and then watch for the more positive effects. But it's really, right now, there's a lot of trial and error. CBD dominant products are good. I like to look for a good broad or full spectrum product. So you're making use of that entourage effect.
Mm-hmm.
So it's going to have CBG, CBN, CBD. It's going to have some terpenes like linalool, beta caryophyllene. Uh, those all have different effects. When you put them together, you get that synergy that we're looking for. And so that's the best thing that I can recommend is if you're going to try one, without going to a veterinary cannabis counselor, pick a product, start low with the dose, make sure there's nothing toxic in it, get that certificate of analysis, and work the dose up until you start seeing positive effects. Back it down if you start seeing negative effects. It really is. Even in the cases that I deal with, there's some trial and error involved. So, we try a product, and if it doesn't work, sometimes we have to switch gears to try a different product that maybe has a little more CBN or a little less CBD, a little less CBG. It's, very, very much a trial and error at this point.
It's definitely not a magic bullet right off the
No,
bat, but
no.
really nothing is. I mean, even with pain medications, you have to go through and you start off at a dose, and even in our experience, sometimes the dose is fine for one cat, but it's too high for another cat, and so, or dog, and so you back that down, and sometimes less is more for them.
Absolutely.
So
Absolutely.
that resonates. That makes sense. We do have a question. So you do this. You have a business doing this. What are some ways you're using it with your clients?
I've used it for as an adjunct to behavior modification. I've used it in cancer cases to help with appetite, to help keep the pet more relaxed and improve quality of life. Use it in arthritis. Really, those are the main ones that I see it in, is pain cases, cancer cases. Um, Unfortunately, end of life care is often where I
Mhm.
see it used, just to make pets more comfortable in those last days.
Yeah, I can say that was a huge part of our experience when we found it. That was a primary use. It was to help him feel better and feel more relaxed. And be able to
Right.
get around.
Just
And
get,
it's funny you say that about appetite. It did actually, I noticed he ate a little bit more because he really didn't want to eat anything, but he did eat a little bit more. So that was end of life is definitely also something to consider it with.
sure.
So there's so much with this topic. I'm so glad you came on today with it. On the website, I know there's if you guys get to go out there and check it out, there's VCS, you guys are working to help with legislation for it. There are scholarship programs. There are Dr. Richter's going down to Costa Rica. There's articles about hemp oil from Dr. Haza. And there's just so much stuff on the side and so much that you all are doing. Can I ask, how did you, and I know this is a passion of yours, how did you get involved on this side as
Well,
well?
another somebody else that works with Veterinary Cannabis Society mentioned to me that they were looking for an extern,
Mhm.
and that's how I got involved. The education aspect is really important to me, of course. Advocating for pets and advocating for pet parents is really important to me. So I saw this as one way that I could do that, by helping and by gathering this information, compiling all these different studies and resources in one place so that not only can pet parents find it, but veterinary professionals can find it. Other, cannabis industry professionals can find it. Those who do the marketing, growers, uh, producers of the different oils and different products. We can have all this information all in one place for everybody to be able to reach it easily.
I think that's fantastic, and that's something else that we wanted to touch on for the summit was being able to find more resources for our fur babies like that. So thank you for all of you guys for putting this together in that site. So we're going to put that in our group. Um, do you think so? This is a big question. Do you think cannabis potentially being approved by Congress? Do you think it'll help with more studies?
Absolutely. Yeah, absolutely.
Finally.
More open that the legal aspect becomes, the more research institutions will be comfortable doing research on the product. I interviewed at a research institute here in Ohio,
Mhm.
and I was disappointed when they said they did no research. They wouldn't even think about doing research on cannabis-based products, and that was it was very unfortunate to hear that such a this is a pretty large lab. I won't mention any names, of course, but it's just
Right.
disappointing that they weren't willing to delve into this when there's so much knowledge to be gained from it.
Well, hopefully that will start to shift, but that's
Yeah,
been our experience as well. So I with what you do, you would be a good resource for fur baby parents that are going out there and they have a cat with cancer or they have even kidney disease. It's safe to still give them with if they have kidney disease
we do. We
or
are more cautious in pets with liver and kidney disease, so we tend to start them even lower dose and
yeah.
increase more slowly. Um, but a lot of kidney disease patients that don't like to eat.
Mhm.
Getting food in them can be more of a challenge. So that's certainly at least one aspect where a cannabinoid or cannabis-based product could be helpful in those patients.
So this would be something that if they have questions, they could reach out and contact you guys or contact you and get some more information
Absolutely.
about that and be able to go in and share it with their vet and their
Absolutely.
team and point them back to the site. You have a
Uh,
question.
uh, when I take on a consult, I not only work with the pet parent, I also work with the pet's attending veterinarian. So I keep the vet in the loop on what's going on, and I think that's really important because we're all part. The pet parent, the veterinarian, and the veterinary cannabis counselor. We're all part of a team with the same goal, which is to help the pet.
I heard that somewhere yesterday too. We're on the same team.
Yeah.
What is the best way for our audience to connect with you? So far, are you working just with clients in Ohio or are you doing that out of state or?
I work
In the
mostly
country?
with clients in Ohio. I am not opposed to taking on clients from other states. Clients from other states just need to be aware that it may take me some extra time to research the laws in their state. So just be aware of that. The best way to reach me is you can either email me at davidthevettech@gmail.com, or you can visit me on Facebook. My Facebook is facebook.com/the Vet Tech. No spaces, no underscores, just the Vet Tech. You can reach me either
Okay.
way. I'm available from on Messenger, through my Facebook page. Email is probably the best way to go about it, though.
Okay. Well, we've got that in our group. We'll have to add the page to our group too. So
Awesome.
I want to thank you for coming because this has been something that's it's been controversial. And we had a comment that there's a lot of closed minds out there. And I think maybe they think that, you're just sitting in your house smoking marijuana and everybody's high and it's just detrimental. But that's not what this is. This is just so different from that. So
Absolutely.
it's something that has a lot of opportunity and promise to it and a lot of hope with it. Because if it's the holistic vets seem to be a little bit more open to it, well, a lot more open to it than
A lot. Yeah.
conventionals. And again, we get it, but there's a statistic on the website that 68% of normal vets had absolutely said, no, we won't even have this conversation. And now more of them are, so that's good. So I want to put the site in our group and your information in our group and be able to tell people this is another resource to go out and, something else to add in your tool
Absolutely.
belt.
It's unfortunate that so many vets still are, they're afraid to talk about they're afraid to have a conversation because they're afraid that what goes wrong, if something goes wrong, it's going to come back on their license.
Mm-hmm.
And it's very unfortunate. Some state veterinary associations have put out to the veterinarians that to their members and said, hey, if you do this, we're not going to cover your license. So a lot of veterinarians are scared or afraid that, and they just unfortunately choose not to talk about it at all. One thing that I try to do is remind veterinarians to at least talk about harm reduction education, and that's that making sure that pets stay safe, making sure that when pet parents decide that we're going to use a product, making sure that product isn't going to do any harm.
Mm-hmm.
Uh,
Exactly.
Eventually, we're going to come to a point where vets that don't at least give that harm reduction education to pet parents may end up on the wrong side of legal issues as well, just for not giving that information out. And that's one of the concerns that I have. So I always tell my colleagues, other veterinary professionals, at least give that harm reduction education.
Can you also, one thing to add too before we go, and this was something that we ran into, always tell your vet, be honest about what you give to your fur baby or what you're trying. Don't go in and give them CBD at home and then don't tell anybody. Go, at least when they ask you what medications are you giving to your pet, write that down.
Yeah.
Send a picture of the ingredients, send a picture of the bottle, something to where they can go back and look at it, because it might also interact with other medications that they prescribe, right? And you don't want to have any bad reactions. Can you speak on that or talk about that real quick for a second?
It's CBD and other cannabinoids they're metabolized by the liver, which is where a lot of the vast majority of other drugs are metabolized too. So if your vet doesn't know that you're giving this product and they put your pet on another medication that's metabolized by the liver, we can run into things situations where that other product, that other medication builds up to toxic levels because it's not able to metabolize as fast. So it's very, very important that you let your veterinarian know, hey, we're on this using this particular medication or this particular CBD product, so that they can take that into account when they prescribe products and maybe prescribe a lower dose to start than they would if your pet was not on a CBD product.
Mm-hmm. I think that's really, really, really helpful. Thank you. Because that was something when we had tried it, two things. We put it down on everything. And we also, fortunately, later on had an oncologist. I won't say a name. We had an oncologist that actually had, and I didn't know this at the time, but the oncologist had used the same thing we had tried. And so later finding that out, I was like, oh, okay, then I feel much better. Because if they had it, okay, then they've been able to go out and they may have access to resources I don't. So that was good. But it was again to that point of sharing, because there were a bevy of prescription meds involved. So it was really good to have. And they were, and that oncologist said, thank you so much for telling this, because sometimes we have to ask clients, hey, are you giving them anything else? Right. Make sure to let us know. So
sometimes I see it. I think pet parents just may not think of it because it's not a medication. I always like to ask when I'm triaging a patient, getting a history, I ask, is the pet on any supplements? And hopefully that, that'll, trigger their brain to say, okay, well, I'm giving a CBD supplement. Mm-hmm. And then I can know about that, and the doctor can take that into consideration. On being honest with your vets too, if you're noticing those toxic signs, or if you're in a state where recreational marijuana is legal, or your pet got into your medical marijuana supply, be honest and forthcoming with your veterinarian when you go to see them. It's incredibly important so that they get the right treatment right out the door, instead of having to try to figure out, okay, well, maybe this is what happens, so let's try treating for this. Just be honest. Veterinarians aren't, we're not the police. We're not here to judge. We just want to help the pets. So being honest with us in the industry is going to be paramount to making sure your pets get the best help.
That was a topic that came down through some of our ER vets too. They said, look, we have people who come in and we think we know, but sometimes they're like, oh no, there's nothing, there's no way they could have ever, and they did. And the ER vet's like, I'm not going to report, just tell me so I know what to do. So Thank you for stressing that. And we stress that. Be honest, tell them. So it's not about you, it's about your fur baby. Get them help. So before we close, have you had a particular case that stood out to you in your experience so far of something that's helped, or something that was particularly harmful? That was
not any particularly harmful cases in my experience so far. One case, it was a behavior case. This dog had really severe separation anxiety. And we started a CBD product, and it really, really helped. The dog had broken out of metal cages, tore its way out of these metal crates, and, tore up doors, tore up floors. It was pretty bad. And, to the point where it had broken teeth, bleeding gums, things like that. Once we started a cannabis-based product, it helps facilitate behavior change. Now, I don't want anybody to think that the CBD alone or the cannabis product alone changed the behavior, because what we're seeing is that's not the case, but it does help facilitate behavior modification. And that's one of the more drastic changes that I've seen since I've been doing these consults.
That is awesome. It helps. It's like, it's not a magic bullet, but it does help.
Right. So. It is very helpful when used alongside traditional medication, and when used alongside traditional behavior modification and a trainer. It's just one more tool in that toolbox that we have.
Mm-hmm. Well, I think with that, we will close out for this session. Again, thank you for coming on, because this is evergreen education right here. And I hope that you guys are able to keep making headway with legislators to try to get some of this moving along. So, absolutely. But we thank you for what you do, and we've got your contact information, so we'll make sure to have that in our group too. And everybody, again, veterinarycannabissociety.org. There are different ways to get involved. You can donate. There's programs. There's a lot of education on there. A lot of resources. Go check that out. And Remember, if you try something, read the label, check the ingredients, make sure there's no toxins. And what was the third one? It was, let me
Ask
scroll
for
back
a
up.
certificate.
Ask
Beware of
for a
harmful
certificate of
ingredients.
analysis.
That label.
Beware of harmful ingredients, check the label. Yes. Thank you, thank you, thank you. So I hope you have a great rest of your afternoon. And thank you so much for coming on with us.
Yes, thanks for having me again.